Today, we're going to discuss what's driving the craziness with your blood sugar problems. If you're wondering why your blood sugar sometimes seems to be stabilized, one time it seems to be high, other times it seems to be low, and you just don't know what you're doing, then you're in the right spot. So I hope you're ready to take some notes or just stay tuned and listen and see how I can be of service to you in this area, just provide on a little bit of information in this area. So when we think about blood sugar problems, immediately what should come to mind is, am I a diabetic? Are you a pre-diabetic? Are you type 2 diabetic? And type 1 is totally different because type 1 is you have it typically as a child and you definitely need insulin, right? So we know we don't produce insulin from our pancreas, so we need some help, right? So when we think about blood sugar problems, I want you to understand that as we think about diabetes, yes, we're going to talk about blood sugar, but at the end of the day, diabetes is a blood vessel problem and not a blood sugar problem. But the biggest complaint that comes into my practice, well, one of the biggest complaints is, why is 1 minute my blood sugar is high, 1 minute my blood sugar is low, and I don't know what I'm doing. I'm not doing anything different today or yesterday or the days before. I'm eating the same stuff. So I want to just touch upon this for a few minutes because it does come up and it is questions because people don't understand what they should do or what should they be considering. So first and foremost, when we think about blood sugar, now, are you checking your blood sugar? Obviously, if you know it's going up and down, but you may not be someone who checks it, right? You may be someone that's like, I feel sort of off. And you may not check it because you may think that I don't know what to do if the number is high or low. And I get that. But at the end of the day, blood sugar problems as it relates to diabetes, if we don't attack it aggressively, it can start to wreak havoc on our eyes, on our kidneys, on our heart, on our toes, on our feet, just all over our body. So remember, diabetes is a blood vessel problem. We have blood vessels all throughout our body, right? So when we think about diabetes and we think about challenges as it relates to the ups and downs and the lack of stability in our blood sugar, I want you to start thinking about these different things. Number one, is there some underlying infection? Is there something going on somewhere else in your body that may be contributing to why your blood sugar is going up and down? So infections can be very obvious where you can see them and it's an infection can be red, angry looking, swollen, oozing some type of discharge. So that's something you can obviously see, an external infection, but you may have something going on the inside. Do you have something going on with the lungs? Do you have an underlying urinary tract infection? Do you have something going on with the gut? There's so many different places that an infection can be quiet and just hang out that can cause problems with your blood sugar. Other things, let's just go into gut since I just briefly mentioned that. Your gut health. If your gut is not absorbing and digesting the food the way it needs to be, it can cause problems with your blood sugar. And when I think about your gut health, it's so very important. Everything begins and ends in your gut. So what are you doing to make sure you have a healthy gut, right? Are you intermittent fasting? Are you eating a clean meal? Are you eating a balanced meal? Are you having your probiotics on board? Do you have your prebiotics on board? Are you working on your microbiome, right? What are you doing to improve your gut health? Are you taking digestive enzymes? Have you even considered that? Have you altered your probiotic? There's so many different ways that we can think about our gut health that I want to make certain that we talk about it. So when we think about the things that can be impacting our blood sugar, other things to consider are your adrenal glands. Now, your adrenal glands are right above your kidneys. You have two on the left and right side. Your adrenals contribute to your cortisol level. So your cortisol level can contribute to your blood sugar going up and down. So if you're not getting enough sleep, if you are having a hard time falling asleep or staying asleep, that impacts your cortisol. So when your cortisol is off, right, your cortisol is causing this wreaking havoc on your body where 1 minute you're up, 1 minute you're down, you feel real tired, you may be wired and tired where you feel like, I want to go to sleep, but I just can't. So what happens over time is that can start to contribute to your blood sugar problems. And what happens is cortisol is a fat storing hormone, right? So if you're not resting, if you are under a lot of stress, which cortisol is a stress hormone, and then you have this impact on your body, then it starts to wreak havoc on your blood sugar. So when you're thinking about the ups and the downs, I want you to think about, okay, are my adrenal glands being impacted? And I know you're not thinking my adrenal glands, but how stressed are you? Now, there's different types of stress. There's good stress and there's bad stress, right? So we have stress as it relates to stress when we get a raise. Oh my God, I got a raise. Oh my gosh, what does this really mean? Can I get another raise? Did I get a promotion? There's good stress. My child just graduated from college. My child just graduated from elementary school. These are good stressors, but there's other types of stress, right? There's stress from not being able to pay your bills. There's stress from caregiving, taking care of a loved one. There's stress from pain. You may have pain in your joint. Recently, I've been having people in my practice who've been complaining of pain in their neck or in their right lower back or in the middle of their back. Or you've recently had a stressful event. Maybe you've had a surgery. If you've had a surgery, that's stress on the body. So when we think about that, the stress on the body truly can have an impact on your blood sugar. So when we think about our body and how much it truly, truly impacts us, I want you to understand this. When you're under stress, we need to do things that we have control over. The things going on around you, you may not be able to have control over, but you have control over you. You have control over, taking a deep breath. You have control over, working on changing your thought life. I'll be honest, not so easy sometimes when you want to change the thoughts that are coming, that are reoccurring and basically causing you to be off your course of focus on getting you to your next level. But when we do things actively to realign ourselves to where our focus is, that truly can help us get in alignment and work more on our parasympathetic side, which is the rest and digest part of our autonomic nervous system. There's a sympathetic side, which is a fight or flight, like going. And then there's the parasympathetic. We want to be more towards the parasympathetic side, right? The rest and digest. Other things that can impact your blood sugar is your immune system. We know our immune system has been a hot topic for the past 2 to 3 years because of all that's been going on around the world, right? Related to COVID. And now we have monkeypox. And so we really need a healthy immune system. But if that immune system is off, then I want you to understand this, that too can impact your blood sugar level. So those of you who may not be a diabetic, maybe pre-diabetic, or just wondering about will I be impacted too? You may not be impacted the same way to the same extent as someone who is a diabetic or pre-diabetic, but truly, your blood sugar will be impacted, but it just corrects quicker. Okay. So your immune system, having your immune system is what's inside of you that fights for you, right? That says, okay, you know what? I'm not going to let this virus, this bacteria, this yeast come after me. I'm going to fight. We want a healthy immune system. So having that on board, having that on intact rather, is really going to help us with our blood sugar problems, as well as we think about our liver. Our liver is part of our digestive system, right? Some of you may, how do I put this? Some of you may have, say, I don't drink any alcohol. Okay, great. Some of you may think, I have a drink every now and then. Some of you may have underlying liver problems. At the end of the day, you want a healthy liver. There's different detox pathways that are inside of your liver. And so when we think about our liver not functioning properly or to its optimal, we want to be optimal in this process, right? When it's not functioning the way we need it to function, then what happens is that too can impact our blood sugar, as well as other medications can impact our blood sugar. Sometimes some of us are on too much medication. I just recently had a patient as recent as yesterday whose blood sugars were running in the 300s, which is high, which is very high. And so this person started to make some changes to the food that they were eating. So they started to eat food that was less inflaming and more that their body was able to process, digest, and absorb. And so the blood sugar started to drop. And the blood sugar still was around 140 to 170. And even with the 140 to 170, what was starting to happen there was they had an issue where they started to have bottom out, where they started to have feeling clammy, feeling as if they're feeling really sweaty, lightheaded. And they even had a point where they felt like they were about to pass out. So when I think about this right now for you, I want you to understand this, that when you start to make changes in your blood sugar, it's better to be high than to be low. But even if you're dropping to where you're the 140s, the 170s, and you're feeling symptomatic, it may be because you're at that point, you're on too much medication. So perhaps you need to go back to your primary care doctor and say, hey, you know what? We need to do some changes here because I'm being impacted. This is how it's impacting my health. So on today, as we think about the erratic nature of what happens with our blood sugar, I want you to understand this. There are some things you need to do. There are some things you need to be aware of. Definitely infections can impact your blood sugar, your gut health, your liver, inflammation, your adrenal glands, your immune system, autoimmune diseases can impact your blood sugar. So I want to empower you to say, I'm going to take control of my health and do some things that really, really help me be the best that I can possibly be. So as we move through this time together, as we talk about blood sugar and the challenge that you may be having, whether you are a diabetic, pre-diabetic, or concerned about other people in your family and whether or not you yourself will get diabetes, remember, genes load the gun, they don't pull the trigger. So when you're thinking about your health, you get to work on you. Not that you have to, but that you get to. So stay tuned as I talk more about diabetes. And I'm definitely going to jump into men and hormonal health because I just had a few patients this week, and we're on Thursday, right? This week, who came to me as brand new patients, and their blood sugar was It was pretty much, I would say, within the range. It was optimized. However, their hormones, they said, you know what, Dr. T, my sex drive is great, my libido is great, everything is great. And then when I looked at their labs, they had low T, which is low testosterone. And then when I really honed in on them and really talked to them about it, they were having brain fog. So for my men out there who may not necessarily be thinking that, you know what, my sex drive is being impacted, or you're good, perhaps your brain, maybe you're having some brain fog. Maybe you're not able to put on muscle the way you used to. Maybe you're not able to recover like you were before when you did your workouts, when you were using your weights and doing body weight, you were able to bulk up and look really good. Now it's taking a longer time for you. Perhaps you have low T. So until the next time, continue to work on you. Not that you have to, but that you get to. Have an amazing Thursday, and I appreciate you so very much. Have an amazing day. Woo, I tell you, my people here, over here in Facebook, it's been great doing this, and I hope that you're getting some value out of our weekly meetings. If you have a particular topic that you'd like for us to talk about, for me to cover, or a question that you'd like for me to answer, by all means, drop it in the DM, put it in a comment somewhere. Let me know, and then I will do my best to address that topic. Until then, I want you to have an amazing day, an amazing week, and continue to work on you. Talk to you soon.